Red Cross to this Silicon Slopes Live. Adam, tell me everything that's happening in your world and what the past week or two has been like for you.
Yeah, Clint, thank you. Appreciate the chance to be on. There's a lot going on. Of course, COVID-19 is occupying so much of our attention. We could say a lot about all the ways that we are participating in response and efforts to flatten that curve, as we're also familiar with hearing. Also that here in Utah, especially Salt Lake County, also here in Utah County, we just experienced an earthquake. We had, with the epicenter in Magna, that's where we saw the most damage. We had a mobile home park. Several hundred units were damaged. Many of those, we don't have a full count yet, were knocked off of their foundations essentially, which also severed gas lines. So we had a hazmat circumstance, opened up an evacuation center at Taylorsville High School in cooperation with that very generous school district and the administrators of that school. We're grateful to them. And then other partners like the Salvation Army came in, helped us with feeding. So lots of response, taking care of segments of that community and making sure that our disaster assessment folks are out helping to look at residential structures, making sure they're safe for people. A lot wrapped up there. Of course, with all of that going on, you do that layered with COVID-19, safety things in mind, the other services we deliver. There's really so much going on. It's all wrapped up in that. It's a busy time to be involved.
Where's your greatest need right now?
The most significant need is one I've not necessarily touched on yet. We have lots and lots of blood drives that have been canceling. In Utah, we're about 4,000 units behind what we typically would collect. That's just a number perhaps, but we're the main supplier of blood for Utah hospitals. Blood doesn't have a long shelf life, and when it doesn't hit the hospital shelves, it's not there for patients. We need help in collecting blood. We need help in existing and new organizations who haven't done it before to open their space. We have everything accounted for to host these drives safely with appropriate social distancing, with measures to screen presenting donors for symptoms, including the taking of temperature and added questions to the intake process, all the safety precautions we can take. We need help with collecting blood. We're in a shortage period now, not just in Utah, by the way, across the US. In the past, by the way, Utah has been a net exporter of units, which is to say we bring in slightly more than we use in our local hospitals. And as a result, we've been able to really bless the lives of our neighboring states when they don't collect as well. We're not doing that today. For now, that's all right. We've got to take care of our own, but we want to be able to return to that sort of broad community, help our neighbors kind of way of approaching that business. So collecting blood, we frankly need help in funding that effort. We're not able to collect drives, bring in drives and collect blood with the efficiencies we typically do with large groups. We have to be small now. So it's a much more expensive endeavor. And so we need help there as well, to be frank.
Yeah. So you're saying it's safe. It's safe to donate blood. You're taking all the precautions as it pertains to that, but you're saying it's safe to donate blood.
It is safe. The process itself, in terms of the physical environments that we set up, are kept safe. They're sanitized over and over again between each presenting donor. You may have seen, many may have seen this morning, it was released a statement by the CDC calling on people nationally to give blood because nationally we're going into a shortage. The CDC reaffirms in that release that the process of giving blood with any organization that's able to do that, and the Red Cross clearly is one of those. We're one of many, by the way, and we're glad for other partners, but we're one of many, and we account for about 40% of the national blood supply, and we're a significantly higher percentage here in Utah. So it's important that we do. It's safe. It is safe.
And how do people donate blood? I mean, where do they go? And I know there's probably a website that shows this, right? Because you're talking about you need it everywhere throughout the entire state, right?
We do. We have 4 fixed site brick and mortar collection sites. One in Layton, one in Murray, one in Orem, and one in St. George. Layton, Murray, Orem, and St. George. Anyone wanting to donate can reach out to those centers. You can Google them, you can look them up. redcrossblood.org is a place where a willing donor can simply enter their zip code, and it will show them the nearest drives to them, which could be one of these fixed sites or a mobile site, which has been set up at a local business, a local church, a local community center. And it's those mobile drives that traditionally are responsible for about 80% of our total collection. And again, that's the reason why we're looking for organizational sponsors to open their doors to help this happen.
So I'm thinking about these mobile drives and the best way that, the Silicon Slopes community and, even the broader business community can help. I'm just thinking we have all of these empty parking lots right now, right? With, everybody working from home currently at all these tech companies.
Yeah.
Would it be useful to open those up to the Red Cross? And what would it take? I mean, how much does it cost to do one of these mobile things? How many do you have available that we could spin up quickly?
Clint, those are great questions. We can use that kind of space. We're limited, of course, in terms of how that happens. We have some people are accustomed to seeing the large Red Cross bus driving down the street. That's a mobile collection unit. We have a few smaller versions of that. Here in Utah, we have 4 or 5 of that kind of accommodation, and we have those deployed throughout the state currently, and we will use them in that capacity. The challenge is how many beds can be on a bus to collect blood? There's usually only 3. So it limits our ability to do that well. Also, because of social distancing, we're not able to use the full capacity of those buses, which is to say we don't bring 3 people on all at once. We do one at a time. So if there is an auditorium sort of space or a large conference room type space, that's what allows us to bring in 4, 5, 6 beds, have them appropriately spaced, and then have an intake area that's also safe distance from those that are donating, allowing them to be screened and the process to be more efficient than it otherwise would be. We will use the buses. We are using the buses, but there are ways we can do a better job.
Oh, that's good to know. So you can use the Silicon Slope space in Thanksgiving Point. Let's connect afterwards because we have private offices there. I think we have 5 or 6 offices in a big conference room in a big open space. We'll make sure it gets sanitized. But you could use that, and if offices would work, I mean, we have plenty of those that are empty right now too, along the Wasatch Front.
Yeah, Clint, and that's a great point. And thank you for bringing that up. The extent to which organizational leaders are comfortable doing it, as space is opened up, it would be so helpful to have some kind of internal outreach to those employees saying and making the case, while we have a little bit of extra time on our hands, this is an opportunity to help lift the community. And then a reassurance of the safety factors that obviously are important, but allowing that communication channel that's so direct to the community, that would be a huge help as
right. So you could have Qualtrics, for example. We're going to be talking to Qualtrics CEO Ryan Smith here at 1 p.m. You could have, and I don't know if he'll commit to this, but we'll get him to, since we're going to have him on one of these. We could have him send out a message to all Qualtrics employees in Provo saying, hey, let's schedule this out. So we're practicing, safe social distancing, right? But the, Utah Red Cross needs our help. So go in here and donate blood. Here's the time. There's a way to schedule all of this.
There is.
So that we can keep everybody safe. And like I said, we'll connect on this after, and we'll send for all those watching now and later, we'll send out details on how to do this. But, we're right in the heart of Silicon Slopes there in Thanksgiving Point. Happy to let you use that office. It's just sitting there vacant right now. I'm in a bunker in Salem, Utah.
Yeah.
So, the more that office gets used for things like this, the better. But you're saying companies could send out to their employees communication saying, hey, I know our offices are vacant right now, but we're going to open them up to the Red Cross during a certain period of time to donate blood. and with those, and then just schedule it out when they should come. So it's not
That's right.
everybody coming at once, you're not standing in line, all that type of stuff. We
That's
can make that
exactly right.
happen. We'll make that happen.
Great.
Let's connect after this on that.
Great.
How is this different than other crises you've been a part of?
We're well equipped to handle any one crisis, call it fairly well. Disasters are always a disaster. But we're trained. We have very generous volunteers, a great cadre of volunteers in our area locally and across the state and across the region. The difference with this one, Clint, is that we started nationally with COVID-19. First concerns and then scares, and followed by, of course, science, which helps us all understand. People are reacting in reasonable and responsible ways. Some people are reacting in ways that some of us might call an overreaction, and yet all of it can work together to cause things to be safe. What that means, though, is that people in general are not nearly as engaged. This includes many of our volunteers whose safety is also important to us. So in this kind of environment, we then have an earthquake, for example, and then we have secondary consequences of COVID also, which is, again, we're told by the state and by the government and by reputable organizations not to gather en masse, which means hosts of blood drives cancel for a good reason, for the safety of their people, but the consequences hit our hospitals quickly. So it's these layers upon layers of impact as different things are happening. We're handling it. It is being handled, but it's important for me to note and attribute the success of that quote unquote handling is not happening alone. It's also not being handled easily. It's not happening easily. And we have a long road ahead of us, as we understand. We're all learning more about that from day to day, but we don't have time to wait. We have to act now. Again, patients in hospitals need blood today. There are car accidents. There are mothers giving birth. There are cancer patients. And we have an obligation that we must fill. And the community will do it. The Red Cross cannot do it. The community, though, with the Red Cross as one among many leading participants, we will together do it.
Are you seeing, in my experience with the Red Cross, there's always these examples of compassion and hope and resilience from the community, right? In times of need. Are you seeing that currently?
We are. We're seeing community leaders in the nonprofit sector, in the for-profit sector, in the faith community that are saying, we know that people are afraid. We're going to step forward anyways. You've heard the adage of paramedics, for example, and firefighters running to the disaster while the rest of us are fleeing. We're seeing leadership on this kind of level where we are battening down the hatches in some way, but they're also opening their doors in other ways to directly confront and address these challenges. There are individual stories too, and some related to the recent earthquakes that we're not used to here. But there are stories of resilience already, and I'm already eager for the other side of all of this when, a wonderful wave and tsunami and flood of great stories come that we can celebrate around and learn from.
Are you in touch with the state government? Because as I'm thinking about this and this idea of, using the empty offices of companies to do these blood drives and scheduling it so that it's safe, are you in touch with the government to do the same thing? These government buildings that I'm also thinking like these schools that are empty, right? I wonder if there's a way for a partnership there to get even more ingrained in these communities, right? Because these companies are all kind of clustered, basically like Provo to Salt Lake, Provo to Ogden, right? Whereas if you could go to like your local elementary school, or if you could go to, another example of one the buildings that are, ingrained in the community is the LDS church buildings, things like that. Are you having those discussions, or is there any way we can help spur that on?
We are, and although we are, I would never turn away that kind of help. That stuff is certainly needed, but we're having discussions at the highest levels of state government, county government. Most cities are also engaging with us. We have a robust and very healthy relationship with the Church of Jesus Christ of Latter-day Saints, the LDS faith group locally. and are working with, to use that vernacular, the congregational stake leaders to reopen their facilities where there's been such great partnership with blood collection in the past. We're working actively to help those doors be open again and help the messaging go out via their channels as well. So the answer is yes. Anywhere where someone can, prompt an influencer on any of those levels on the side within their own sphere, we welcome that. We need that. And as those things are or aren't happening, we're also working our channels. Yes.
Well, Adam, as we've been talking, Yesco has offered to give you free billboard space as we've been on this call. So we'll make sure you get connected there to send some, spread some awareness and, get people going the right way. So thank you to Yesco for doing that. Literally, as we've been streaming this,
that's wonderful.
They
Thank
just
you.
Reached out.
Thank you, Yesco.
And yeah, you're right. I love the, and again, I apologize to everyone. I said the LDS Church. I'm so used to that. It's the Church of Jesus Christ of Latter-day Saints. I want to make sure I'm saying that that properly. Are there other ways that we can help?
It's no one likes to ask for money necessarily, or even in many cases be asked for money. But these endeavors that I've described are expensive. And while they're always expensive, and we have great partners that help us with that under normal circumstances, this is anything but a typical circumstance. The Red Cross has seen its costs increase many fold during this period because of our need to ramp up operations to account for blood shortages across the nation. Locally, I'm tasked with collecting, with helping to bring in and to help fund the total picture locally and even to some degree nationally to the tune of about $250,000. That's not just going to happen, as I hope or you hope. And by the way, I'm also not unaware that there are many organizations right now who need the same kind of help. Doing some work with the blood bank, with the food bank locally, with community action. As I know, Silicon Slopes is very involved across the state. That's kudos, by the way, such a needed thing. A part of the evacuated group during this earthquake, by the way, was a couple of damaged homeless shelters, one in Salt Lake and one in Ogden, they didn't receive as much damage in Ogden, of course, but there was a challenge there. And so we're supporting those groups too, and feeding people that are displaced. And again, all of the things that are needed with collecting blood under atypical circumstances in a much more expensive way, because we can't look at efficiencies based on large groups. We need help there. So, and especially organizationally, but individuals of means as well, where help can happen there. I invite that. I'm asking for it, in fact.
Well, on that note, Silicon Slopes has launched a fund for this exact reason to help those within our community who need it most. So for those watching, if you go to slopeserves.com, we'll direct funds to folks like you, Adam, and organizations like you, the food bank, and kind of across the board. So go to slopeserves.com and we can direct the Silicon Slopes community fund directly to there. I also want to make a call to action to companies and entrepreneurs out there. If you're able, if you're willing, if you have the bandwidth, please reach out to Adam about hosting a blood drive inside of your empty workspaces right now, and talk to him about how we do that. Again, like, make it safe, schedule your employees so it's not everybody coming at once. We'll make sure everything gets sanitized and everything's fine, but the Red Cross needs our help. And if companies watching this and entrepreneurs and leaders within the state are watching this, this is a great use of your space that's currently sitting empty that will make a huge difference. Adam, thank you so much. Anything else you'd like to say to the group?
Clint, thank you for the time to speak with the group today. Again, I said it once, I will say it twice. The Red Cross is not the only ones working through this. And for our part, what we do, we also cannot do alone. So for the partnership in blood collection, the partnership in willing volunteers, the partnership in funding these life-saving, extremely important endeavors, tip of the hat, thank you. It is a community of help and it would not work otherwise. Thank you.
Adam, how can people get a hold of you?
If there's some, adam.whitaker@redcross.org. I'm on LinkedIn and play on there. I don't play. I'm on there periodically. 801-318-8800. I don't know what our listening audience is. I just gave out my personal cell number. Maybe that's a mistake. Maybe that's not.
It's fine. This is a respectful community. So Adam.Whitaker@redcross.com.
.org, yes.
.org. Sorry. Yeah. Adam.Whitaker@redcross.org. Reach out to Adam to help him because blood is needed during this time. Adam, thank you so much. Really appreciate it.